Hello, my name is Krista Otsu, and I will be presenting on schizophrenia.
The word schizophrenia literally means split mind, but contrary to popular belief, the condition has nothing to do with a split in personality or multiple personalities. The term refers instead to what's sometimes called a split from reality.
What is schizophrenia? Schizophrenia is defined as a serious mental illness that typically is characterized by at least two of the following features: delusions, hallucinations, disorganized speech, and negative symptoms such as poverty of speech, lack of motivation, grossly disorganized, or catatonic behavior. Symptoms of schizophrenia. Symptoms can either be classified as positive or negative. Positive symptoms include delusions, hallucinations, disorganized speech, being grossly disorganized, or exhibiting catatonic behavior. Negative symptoms include affective flattening, which means motionless and unresponsive face, poor eye contact, and diminished body language. Others include alogia, also known as poverty of speech, and incapacity for goal-oriented activity. Brain structures. Brain alterations that are noticeable in people that have schizophrenia includes lateral ventricle enlargement. Research is still unclear as to why, but they know that it is due to the genetics of schizophrenia. Further research is still needed on the subject. Neurochemical factors. Schizophrenics have abnormal levels of neurotransmitters. These are what allows nerves to communicate with each other. Images of the brain have shown that schizophrenics have less neural tissue than that of a person who does not have the disease. The loss of brain tissue accounts for poor short-term memory. Some believe that it is genetics that causes the brain miscommunication and results in schizophrenia. Along with other cognitive dysfunctions, working memory is said to also be affected. Prognosis. Unfortunately, there is no cure for schizophrenia, but with the right combination of medication and therapy, they will be able to live happy and satisfying lives. They say that the key to control this illness is early diagnosis and treatment. It is also good to find out if you have a family history so that you know if you are at risk of developing symptoms. Quality of life. Quality of life is defined as a person's sense of well-being, health status, and satisfaction with life circumstances, including access to resources and opportunities. Unfortunately, patients with schizophrenia experience a significantly lower quality of life compared to the general population. They usually have high BMIs and smoking habits. Patients that are on a higher dose of antipsychotics do report higher quality of life than those with a lower dose. Available treatment. Available treatment includes antipsychotic medication, psychotherapy, and cognitive behavioral therapy. There are a variety of antipsychotic medications, but they have different side effects. Side effects can include drowsiness or dry mouth. Some may also have long-term consequences. After being on antipsychotic medications for a long time, the patients might develop something called tardive dyskinesia, which is characterized by abnormal movements of the mouth and tongue. Although medication may have a lot of side effects, so far it seems to be the best form of treatment for someone that has schizophrenia. Conclusions. Overall, I think that a lot more research should be done to see if we can find more possible forms of treatment without resulting to medication. I know that if I would be diagnosed with schizophrenia, I wouldn't want medication to be my first option. Another important factor would be education for people with schizophrenia as well as their family. It's really important so that they can feel supported during their treatment and so that their overall quality of life could increase. Thank you for watching my presentation. The following are my references.